Welcome to the place where we gain knowledge through the lens of creativity. I am Aaron Dworkin, and this is Artful Science. Thanks again for joining me here on Artful Science. Today's show is Lives Cut Short, Health Inequality and Life Expectancy. And my guest is Gigi El-Bayoumi, Professor of Medicine and Founding Director of the Rodham Institute. Gigi, welcome to the show.
Thank you so much, Aaron. It's a pleasure to be with you today.
Well, and it's an honor to have you as a guest on our show. So I figured I would just dive right in. Do people of different races or income levels have different life expectancies?
In the United States of America, yes, they do, very sadly. And one of my colleagues coined a term, the structural and the social determinants of health actually account for 80% of why we live for a particular, to a particular age. So I'm going to give you an example. In Washington, D.C., it's not a very big city, 10-mile span. The richest part, you can live on average 94 years. The poorest part, which is predominantly African-American, your life expectancy is 66 and a half. So imagine almost a 27-year gap, and we are the capital of the United States and arguably the richest country in the world.
Wow. All right. I mean, literally all I can say is just wow.
Yeah.
And I think that, right, this is a story that's told across communities across the country. I think here, in Southeast Michigan, where we are in, cities or in counties like Washtenaw County, there's at least a decade disparity. So clearly this exists. Why? Why is there such a disparity? What specifically is causing it? There are certainly some in our society who say, well, biological, race is a cause, environmental, is it money? Why such a difference?
So let's talk about what the structural and social determinants of health are that account for 80% of these outcomes. So structure means the structural racism that African Americans or Africans of the diaspora have been living with for 400 years. Structures are when you come to the doctor and somebody is not polite or treats you in a way that does not respect you and your dignity. Social determinants of health, and that term is a little tricky because it almost sounds like we are blaming the victim, and that's not the case. Food security. Actually, food security is the #1 social determinant of mental health, which we're in a crisis with right now. So for example, in Ward 8 here in DC, there is only one full grocery store that serves 80,000 people. Housing, right now, we're going to expect several million people that are going to be evicted in January. We talk about education. Let me give you another example. If all I did as a doctor was to get kids to graduate from high school, I would add 10 years of life. The water that we drink, the air that we breathe. So those are but some, and then 20% really has to do with access, and not just access, because in DC, 97% of our residents actually have insurance. And yet we're #1 per capita in cancer mortality in the country. So access is a piece, but it's not all of it. The quality of care, how you are treated, the rapport that you have with your clinician. So there are many parts, but I want to emphasize that when we're talking about solutions, we can't just do this sequentially. Oh, you take care of housing, I'll take care of health. No, these have to be addressed at the same time. And for the same individual, same family, and same community, all at the same time. It cannot be piecemeal.
Right. And so, for many of my audience members who may come from some of these communities that you're talking about, where these disparities are something that we face, one of the things that I often have heard is either a distrust Especially I have, people I know very, very well, and especially older generations of color who have a deep distrust for certain, for the medical professions or field, thinking about certain things that have happened in the history of the country. Does that play a role, that distrust, when it comes to kind of relationship with healthcare providers?
Absolutely. And that's why it's important. And our work at the Rodham Institute is to increase the number of Black and brown doctors, because studies show that if you're a Black male and you see a Black male physician, guess what? You live longer, your outcomes are better. But I want to just talk about this issue of distrust, because there is no other place that is playing out more acutely than right now with COVID. And so that's why the Rodham Institute is part of the Black Coalition Against COVID, which was founded by Dr. Reed Tuckson and Mr. Ambrose Lane Jr. It brings together the 4 historically Black medical schools and their presidents, the education sector, the labor sector, the business sector, and we've been having a number of town halls to be able to answer those questions, because there are all kinds of historical reasons that date back hundreds of years, and even in relatively modern history with Tuskegee and Henrietta Lacks that we can go on with. But I think that the COVID vaccine and how it was developed and the oversight of that, we need to get the word out about who is overseeing that, because the reality is there are many sort of checkpoints, checks and balances. And there are lots of clinicians of color, scientists of color. Did you know that actually one of the vaccines was developed by an African-American woman? So there you go.
Absolutely. Critical information, and so glad that you're sharing this, which is so important, especially for our audience. You mentioned too about, kind of food security and issues related to food. I definitely sometimes hear people who talk about it and say, oh, well, especially these communities of color and their health, it's their personal choice. They don't eat right. I have this, diet. I pay attention to what I eat. They eat, junk food or whatever. What do you say to that? Is there a personal responsibility that's wrapped up in some of these health issues, or how would you respond?
So when people say that, that's coming from a racist place. I'm going to say it plain and simple. Not that personal responsibility should be abdicated, but I will tell you, and studies have shown, and specifically here in DC, when some of our wonderful not-for-profit organizations such as DC Greens tell a corner store, look, we're going to set up the fruits and vegetables and we'll give you the profit. Guess what? Within an hour, the fruits and vegetables sell out. So this is a myth that keeps getting propagated. And of course, the food choices that we make also have to do with education. I don't know about you, but especially during COVID, a lot of people are eating comfort foods. So what is the role of one's own mental health when it comes to food choices? So it's there are complex reasons, right, for us to choose the foods that we do. But remember, all those Hollywood types that look great have their own personal chef, they've got their own personal trainer, they've got foods that they can get organically. It would be a problem if they didn't eat right and look great, right? Most people, and certainly under-resourced communities, don't have that same kind of access.
Totally. Well, and I'm still waiting to try and figure out how I can get my private chef and trainer and all of that. So as we think about this, and we're just beginning to run short on time, but if you mentioned there's all of these factors, and it seems so complex. Is there, or if there was kind of one key measure or factor or that you could change in terms of a public health policy, or that my audience members should really kind of try and fight for? Is there one that you feel is kind of dominant or would bring about the most impact?
I will tell you what the answer was to one of the young men who has schizophrenia. He's 25, and I asked him, what would you want the physician or healthcare community to do differently? And he said one word: be heartfelt. Heartfelt. Because if we lead with love, and if we really care about every member of our society, be they old or young, LGBTQ, disabled, have mental health issues, Black, brown, first generation, homeless returning citizens, that will improve the outcomes, because policy that looks down on these groups of people has really been the driving force, specifically in this administration. It's been a cruel, cruel administration. So if we are just heartfelt and we lead with love, I promise you that yes, it's going to be a hard and tall order to try to fix these issues, but we can do it if we lead with love.
Wow, that's just incredibly powerful and so impactful. So before we close out, I always like to ask my guests, there's so many cross sections and connections between the arts and the sciences. So I'm just curious, do you have any artistic either practice that you do or arts that you feel passionate about?
So you know what? I always joke that in my next life, I'm going to be a dancer. I love to dance. I love music, live music, and I'm actually writing a novel. So all of the above. My sister is an artist. You can actually see her artwork behind me. My brother is an actor. I think that arts are going to be the way that we heal as a society. I always say this, and not just because I'm talking to you, Aaron. Art is the key to our healing.
Wow. Gigi El-Bayoumi, thank you for helping us gain knowledge through the lens of creativity here on Artful Science.
My pleasure, anytime.